The main cause of death in several countries in the world is heart disease. However, liver disease seems to track the number of deaths and has reached epidemic levels in our country. As Dr. Rosmavati in Code Blue Health as Human Rights said, non-alcoholic fatty liver disease is the most common liver cancer today. The cause of liver cancer death in Malaysia increased by 31.5% from 1990 to 2020. Most of the deadly diseases in Malaysia, such as ischemic heart disease and fatty liver disease, are also linked to obesity. According to an interview with the Daily Express with a hepatologist, ASIC, Professor Dr. Chan Wah Kang announced that more and more patients with common symptoms of liver disease are coming to the hospital. So we have to plan to develop a fat heart and have a secret Malaysian killer. The liver is one of the vital organs for humans. The liver processes all the food we eat into substances our bodies can use. Obesity in the liver is more common in adults because children and adolescents grow rapidly and lead more active lifestyles. As a result, their bodies use most of the energy they get from food instead of converting them to fat, which is a form of fuel storage in the body. In comparison, adults' energy expenditure is much lower and steadily decreasing as their lifestyles gradually become more inactive or less busy than at the beginning of their lives. Therefore, adults should eat less than other age groups, which is proportional to their energy intake. However, most adults do not reduce their food intake, which causes fat buildup in the liver, thus forming a fatty liver. There are many symptoms that can indicate fatty liver, such as right upper quadrant pain, jaundice, and fatigue. However, fatty liver is usually asymptomatic in its early stages and only becomes a symptom when the liver has reached a severe state. This is why most people don't realize that they have a fatty heart and only seek help when it is too late. Not to mention that the fatty liver not only reduces its own function, but also affects other important organs. For example, liver disease tends to distribute cholesterol to other cells through the blood. If a person with mentioned liver disease consumes excess cholesterol, they are at a higher risk of developing atherosclerosis. This is a condition in which cholesterol builds up on the walls of the arteries, and this can lead to ischemic heart disease. To maintain a healthy liver, we must eat a healthy and balanced diet in addition to regular exercise. This is because fatty liver can happen to anyone, but people who are obese have been shown to have a much higher risk of developing it. So a normal body mass index, BMI, and body fat percentage are needed to reduce the risk of fatty liver disease. Negatively, the Malaysian lifestyle has become increasingly unhealthy for days. Indeed, Malaysian street food is too tempting to refuse, and this makes it very difficult for Malaysians to reduce their food intake. Not to mention, some people like to spend their weekends looking for food to satisfy their viral food cravings. Even worse, there are several types of unhealthy trends such as chocolate cups, ramen and cheese, chips which are widely available and easily available in the market. In addition, the number of shops selling sugary drinks and drinks has also turned into mushrooms. This trash is really tasty and fun because it's obvious how regularly it is consumed. However, excessive consumption burdens the liver as it is forced to work harder to process food. If a person continues this bad habit, it will definitely have a negative impact on his health. Apart from our unhealthy lifestyle, the COVID-19 pandemic is making things worse. Due to the pandemic, our government has completely blockaded the country to limit the spread of the virus. Recreational parks, shopping malls, workplaces and even schools have had to close to stop mass gatherings. So there is nowhere to go. People are more likely to spend time at home and limit and reduce their daily movements and activities. In order to recharge without having to do much, people tend to develop boring eating habits. If this condition persists, the percentage of Malaysians who are overweight increases, increasing the risk of developing fatty liver. After all, there should be no reason not to take care of your health. There are many ways to achieve and maintain your physical fitness at home. A simple example is the fact that we can watch and follow various exercise videos that have been uploaded to various YouTube channels. It is unfortunate to see that most people know the need to be healthy, but very few people practice a healthy lifestyle. In addition, it is important for us to maintain a healthy lifestyle and a balanced diet to ensure that our organs, especially the liver, are in the best condition to play their role and function properly in our body. After all, good health cannot be bought by anyone, and it is arguably the greatest blessing a person can have. Get stem cell therapy to re-energize your body and look younger too. And to cure more than 200 diseases, subscribe to our YouTube channel and also share to family and friends.